right, it's 10:25. We're going to kick this back off. I'm hoping all our panelists are ready. I'd now like to welcome representatives from Ambetter, Anthem, Cigna, Harvard, and United Health, who will participate in our price transparency carrier panel. Since Ambetter and Cigna are not in the small group market, we'll be directing most of the price transparency questions to these characters. As before, please submit any questions in the text box to the panelists, and we'll ask those questions at the conclusion of their presentation. Our Life and Health Director, Tyler Brannen, will moderate the panel. Tyler?
Thank you, Commissioner, and good morning. And hopefully we are able to highlight the panelists, and perhaps it'll help Andrew if one of the panelists, if you can raise your hand so he can find you perhaps a little bit quicker. So I am the Life and Health Director with the Insurance Department, and on our panel, which as the Commissioner mentioned, will be primarily focusing on Ambetter and Cigna, we have Clyde White, who's the Plan President and CEO of Ambetter, and we have, I believe we have Elena Butkus from Managing Director of Global Policy at Cigna. We should also have Maria Peru, who's the Regional VP of Sales at Anthem, Kate Scatores, who is the Regional VP for New Hampshire Market, Harvard Pilgrim. I believe we may have Caitlin McCormick, but coming a little bit late. She's the VP of Sales for United and the Tufts Freedom Plan as well. So it looks pretty good. Looks like we're getting most of the people we expected. So we'll go right into this. Just by way of background, I think that most people are aware about the New Hampshire Insurance Department's efforts with health cost, which is one of the first price transparency websites in the country, and still relied on much longer than we expected. We initially thought it might have a shelf life of around 5 years, but we're happy to say the information provided is still of value to people, and we continue to develop the website in a number of different ways. Beginning with 2021, the hospitals were required to post not only their charges, but negotiated rates as well. There's been a lot of press coverage in that area about how compliant hospitals across the country have been with those expectations. There are future federal price transparency requirements that apply to carriers beginning next year, which will include a machine-readable file and actual rates that are negotiated with healthcare providers. And then going into the next 2 years, there will be consumer-facing websites with 500 services the first year and an unlimited number the following year. So a lot of developments on the price transparency front. I'd also mention that the Insurance Department just released the fourth iteration of our discount study, which is a way of looking at the reimbursement rates that insurance carriers are able to get with providers on average, mostly to give us a better sense of how competitive our market is. Unfortunately, we still live in a world where much of the reimbursement is fee for service, and the sort of effectiveness of those contracts will lead to the success of our carriers in our markets. Over the past, we have seen carriers exit the New Hampshire market when they were unable to get the kinds of discounts that would be competitive with our largest carriers. As mentioned, yes, there is the opportunity to ask questions. I've got a number I'm going to run through. If you put them in the chat box, I'll either observe them or we'll get Dawn to bring them to my attention as we get the chance for the public to ask questions of the panelists as well. So I would start, and I guess I'd start with perhaps directing this again to Ambetter and Cigna, but starting with Ambetter. And the first question is just what kind of price transparency developments do you feel are most helpful to your organization? And separately, would it be any different for consumers? Clyde, you want to take that one?
Sure. So basically, I think that the cost price transparency tools that have been developed have been extremely helpful. I think they've been helpful across the board, really, for consumers, providers, as well as carriers, but particularly for consumers, so that they have that additional information. I look at tools like the all payer claims database, which was pioneered here in New Hampshire and is documented as reducing overall costs. And so I think things like that are help to empower the consumer, which ultimately helps all of us.
Thanks, Clyde. Elena, you're on mute.
Thank you so much. Okay. um, I think completely and utterly agree. On top of that, um, I think that mobile applications and web-based solutions for customers are needed for really the access to personalized healthcare information, kind of when consumers are on the go. They really need kind of the seamless way to make informed health decisions. And that would include, in particular, not only cost estimates, but detail ability, for example, to search for real-time drug prices at participating pharmacies, kind of looking for less costly alternatives and being able to take a look at quality ratings as they're on the go. For us, we basically, at this point in time, we're around 8 million cost estimates for about 730,000 providers, but we're covering about 1,000 medical procedures. So we have a ways to go, and that would include expanding the available information we have to include kind of behavioral health care, physical therapy, and our aims are to try and do that next year.
Right. So it sounds like both of you feel as though that the prime advantage is giving the information to consumers so they can act more effectively as purchasers of healthcare. Is that what I'm understanding you to say?
Indeed.
Absolutely.
Okay. Well, that segues well into the next question. Some people have suggested that patients actually knew the cost of healthcare, knew the price of healthcare. They would avoid healthcare providers or getting services in general. That may mean sort of self-rationing of healthcare, perhaps in an appropriate way sometimes, or perhaps in an appropriate way in other ways. What are your thoughts about kind of those types of outcomes? And this time we'll start with Elena.
Sure. I'm not really a believer in the construct that if patients knew the price of healthcare, they would avoid providers. For me, I think about my family. Like if my daughter needs an organ transplant to save her life, or I've got a family member in an ICU, any rationing is going to occur on the supply side. For the subset of educated patients and beneficiaries who are able to compare costs, not in that kind of situation, the right circumstances have to surround the opportunity to use the tools. So that's kind of how I look at it.
Okay. Clyde?
I agree. I mean, I don't see it, the information leading to rationing. I see it more as the consumer being informed and seeking a place in which the price point may be better. I also know that for our organization, we have a considerable amount of effort dedicated to care management, to helping the patient navigate healthcare, to find the care that they need in the right place, in the appropriate setting for them. And so I think that is just another arrow in the consumer's quiver, and something else that we would use to work with them to get them the best care possible. But I don't see them sacrificing anything.
Okay. Harvard, Anthem, any of you guys like to comment, or Cigna?
Sure. Tyler, can you hear me?
We can hear you. We can't see you.
Oh.
Yes, we can see you now.
Okay, great. Yeah, my bandwidth was choppy. So, I think in large part, Anthem agrees with most of the comments that were made. I think, we're very passionate about transparency. We've had our own transparency tool in the market for many, many years. And we agree. We don't think transparency will result in consumers rationing care. We just think, as Clyde said, it's about an informed consumer. And if you provide the information in a consumable way, which I think that's the key, then, members, consumers will shop for care, and they'll look at the cost of the services and determine if there are alternative options for themselves. But we don't think that it would result in people just not accessing care.
I was just going to comment, Tyler, that from a transparency perspective, at Harvard Pilgrim, we're fully supportive of these efforts that give consumers the personalized information they need to make informed healthcare decisions. I think if I'm going to offer a thought to this group, one would be, we want to increase access for our members and for their healthcare options. We want to make them fully informed about the cost of the services, but we also don't want to sort of inhibit the ability of providers to give that expert advice on their healthcare needs, right? And I think that's something that I've seen raised repeatedly, which is, having members engage with providers is important, and not assuming that they don't need a service and choosing not to get that service on their own because of the cost of the service. So the dialogue between members and providers is important. And it's something that I think, as payers of healthcare, we need to make sure our members are getting all the information they need in addition to cost. At Harvard Pilgrim, we have a tool called Estimate My Cost, which is an online tool, and that members can go on there before they receive services and just get a general sense of what those would cost. You can search for providers, and it's been very helpful for our membership to have that that tool at their fingertips.
Any additional comments? Thank you, Kate and Maria. All right, I'm going to the next question. And these are related, obviously, but in what ways should we expect consumers are remembering that they're patients to make compromises as they use price transparency information? We have seen over the years, when you start to break down something like hospital prices, you could find that a hospital might be very inexpensive on the outpatient side and very expensive on the inpatient side, or you may find that a certain set of services are very cost effective at one location, but then others are more expensive. Benefit designs have evolved to the extent that there is lower cost sharing. If you go to some providers, sometimes it's a little bit of a softer touch. But the question more generally, in what ways should we expect consumers to compromise, even if it just means looking up the prices of healthcare services before they just accept that referral blindly? And why don't we start with Clyde on this one?
So basically, don't know if I quite call it compromise, but yes, I agree that you're probably going to see more people looking up or using the cost price transparency tools as we move forward. I think we're more of a data-driven society now, and even more so as time moves on. So you are going to see that. I think there may be potential for people to then access care in places where they feel that they can get the best, not only the best quality, but also the best cost on top of that. I think that at least for us, we're blessed that we're in an area with a good number of quality providers. And so there are a number of options. We offer a broad network, and our members would be able to access that and get the care that they need. For us also, as I mentioned earlier, we have a very strong care management program that would work with the members in order to avail them, make sure that they're aware of their options, and also focused on getting the necessary care.
Okay, so it sounds as though you would expect them to, well, maybe have the same cost sharing, depending on, regardless of where they go, look up the prices, act on those prices within sort of their standard deductible amounts, but perhaps take advantage of some of the care management programs you have as well, which may influence their decision. And you could consider that perhaps an element of quality as well. Is that kind of a summary of what you think?
Yes, that is exactly right.
Okay. Elena?
And I'll just add, on top of care management, I think the predictable user experience is more information kind of it comes into being, will be really, really important, so that consumers can make those easy decisions, be it the appropriate choice of product for the care and the price desired, be it variable network options, be it education tools that might support variable understanding of what insurance carriers are offering. So that's the only thing I'd add.
Would either, I guess, either of your carriers that we just heard from, is there the opportunity perhaps now that prices are in the public domain so much more frequently, some of the tools you made available, that you could create benefit designs that would include narrow networks of either hospitals or other providers, and that would be something that your members would accept, knowing more about the prices? Is that an accurate representation?
I believe it.
Okay.
I believe it's an accurate representation. I believe that different types of beneficiaries that we all serve are in need of very different choices of products, and in some cases, narrow networks, for as much as we might be squeamish about them, are an absolute need, because it's better to have really some product that you can buy as opposed to really not being able to afford one.
Yeah. So from my perspective, I mean, I think we consider everything. I think for us, the main focus is how can we put the best product forward to the marketplace and to our members. We would be evaluating just based on not just cost, but overall quality and overall impact on our community. And just based on those factors, just determine whether or not narrow network would work for us. So it wouldn't just be a cost decision, but we would be looking at all potential options.
Great, thank you. Any additional thoughts from the other carriers?
Sure. So I think, as I was saying earlier, and I think this really gets at it, it's, how consumable is the information? And, I'm not sure that the current efforts underfoot would really sway our decision one way or the other around narrow networks. I think Anthem has had a narrow network product in the market since 2014. We've actually expanded that narrow network into other segments. We started with the individual market. And I think the success of a narrow network product is really around how you display and provide information to your members. Again, is it consumable? So do your tools reflect who's in network, who's out of network? Do your tools give your members an adequate way to understand their costs? So I think cost alone, or posting of hospital charges alone, are not always the most helpful. I think what's more helpful are the tools where members can actually estimate their costs. So how do the overall costs compare once the benefit design is applied? So the cost sharing. So I think with regard to a narrow network product, you want to make sure those transparency efforts and those tools, of course, show which providers are in or out of network, but also what are the costs going to be based on the member's benefit design.
Is there another comment? Okay. I'm going to take a question from the public because it is directly related to what we were just talking about. And for perhaps each of you, are there any concerns about disparities, access to the cost tools, health literacy, or even who has access to care management? And Clyde, do you want to comment on thoughts there?
So basically, we're always trying to make sure that the tools and information is available for our members. Basically, we'd be looking to promote this as best we can to our members through all appropriate channels, be it the information that they provide us, the contact information, as well as working with the actual providers themselves to help educate the members as they come through the offices, as well as our community partners, just to make sure that one, we're getting the word out, and two, that we're trying to access and provide several doorways by which our members would be able to access the information. As far as who has access to care management, again, pretty much the same thing. We'd be looking to promote that, and we do notify all of our members. We also outreach to those members who we determine may have a particular need, and also invite those members who feel or want to have additional assistance, just to reach out to us, and we'd be able to connect them and include them in that program. And again, we also provide this information and work with our provider partners as well as community partners to bring members more into the fold with regard to this information.
So the efforts you're making with the provider community, does that include price transparency information?
So with regard to price transparency information, to the extent that we're providing that, I know we're working on the process right now to offer that in the machine readable format on our websites for next year. We'd be notifying our provider partners that was available, and also casting out the word to our members as to where they would be able to access that.
Cigna?
I'm going to start, and then I'm going to hand it to my colleague, Anthony Kelly, who's over network for Cigna on the East Coast, but in particular, New Hampshire. It is an awesome responsibility to provide consumers what they need, and the three buckets of issues that ensure that they get what they need, that include, for example, healthcare, addressing healthcare literacy, and that they understand what we have available is an imperative. With that, Anthony, I'm going to let you add some comments on providers, if you could.
Yep, that's great. If I can just add, it is really important being able to reach out to your customers, or being available for your customers or your enrollees. So at Cigna, we are available 24/7 for our enrollees, and they can call in and speak to a customer advocate who can help them with many things, finding a provider, helping them understand their benefits, their out-of-pocket costs when they go to certain locations for care, also helping them with the tools. So I see in the chat a question on not just health literacy, but there's also digital literacy, right? And so helping them understand how to access the tools, how to use the tools, how to get to that cost information, how to understand what their out-of-pocket obligations are. Our tools are available not just for our customers, but they're available for our providers as well. So our providers can access the same cost tools that our customers or enrollees can. They can see what the out-of-pocket obligations are for the particular patient that they're seeing, and they can access that through our provider portals. We also work very closely, our clinical teams, with many of our providers across the state, identifying individuals that can benefit from an outreach from their provider's office, and coming up with ways to outreach those individuals and to help them understand where the opportunities are for them to either engage in their health or to use the tools that are available to them. So we try to get at it in multiple different ways by providing access to our members, access to our providers, and proactively outreaching where we identify the opportunities.
All right, thank you. in terms of, I guess, the communication that you would provide and direct this to any of you, are there limits, I guess, to what we can expect from members or consumers? In other words, going back to some level where I started, ideally you provide perfect information, they'd be able to act on it. It would be so specific as to where they can get the services and when. And then similarly, where are we going in the future? I mean, to the extent digital literacy increases, the product designs and the products you make available, the access for members, do you think that we're going to be able to do something in the future that lends itself to price transparency, more informed consumers, and a more efficient market? But we're not there yet. Ambetter, Cigna, any thoughts on this?
I'm going to start. There's a long way to go, right? Like I said, we have 1,000 procedures on the website and building both on the cost and the quality side. I think that the last 2 years with what the federal government has done with the transparency legislation and regulations is going to open up a lot of additional avenues for information to be used by consumers. The ability to look at the machine readable file data, both as a regular business practice and to figure out how that might advantage our consumers and or providers is going to be just a really important time in history as the data opens up. And with that, Anthony, anything you'd like to add?
Yeah, I would say I think it's really important that our enrollees or members utilize some of the tools that are available to them today, because they put together a more holistic package of a visit. So as opposed to understanding one individual item cost, they'll understand the potential cost for the event, and it gives them a broader picture and a broader understanding of their benefits and how their benefits apply to the services that they're seeking. I think the transparency files are a great step forward, and we do look at what's available today. But if you take a step back for an individual consumer, they then need to have to figure out how to piece that together as an event. And that, I think, is going to be a challenge for many individuals to understand that, an individual consumer, and use that. And I think our tools do a good job. Cigna's tools that have been out there for almost 10 years now do a good job of packaging that event together for you and just giving you that deeper understanding of what to expect and what my costs are. So when you price shop, which they can do that in our tools today, they get a better picture holistically of what to expect.
Are there any transparency efforts or sort of initiatives or maybe even requirements that you just feel are not helpful, not useful? Ambetter, Cigna?
Yeah, I'm gonna start. I'm gonna go back to the use of machine readable files. They are useful to the extent that they are meaningful to the end consumer. And we do have concerns that those files could drive healthcare costs higher in certain instances, right? So although plans and issuers will be reviewing the data, the same is true of providers, both sides of the aisle. And once negotiated rates are public, right, people will use that data to their advantage. When you look at highly consolidated provider markets, right, it is extremely difficult to negotiate rates in those areas. And so to the extent that the machine readable files are useful to the end consumer, great, but we have all some experiences that they can be used to the detriment. It's really what happened in the Medicare Advantage market, and so we're very mindful as that information goes out into the public.
Thank you. Clyde?
I think we're mindful of that concern. I think just to touch upon a point that Elena made, just that just the manner in which the information is going out, and is it in a format that the consumer can readily understand, and just with regard to the technology, is it in a place where they can easily access it based on the type of tech that they have now? I think that we're in a relatively good place, but it's still evolving, it's still adapting, and I think there'll be much better processes and better presentation as we go forward into the next years.
Makes sense. Have either of you attempted to use the hospital files that were required as of this year and better understand your relative position compared to competitors with that particular hospital? Has that been a productive effort, or have you even tried? Ambetter, Cigna?
I'll start. Up to this point, we have not. I anticipate that we would probably include that in our process going forward, but not yet.
So we have, and we found the data in the hospital transparency files that have been made public to date have been inconsistent, which limits the usability. We have nonetheless begun analyzing the data and trying to consider it thoughtfully, despite the limitations of the data itself. We do support the transparency efforts, and we'd encourage you to consider some meaningful changes to make the files more usable to consumers and end users.
Any additional comments from Harvard or Anthem?
I would just say that we echo the idea that we would support the fact that we don't want to reduce incentives for providers to offer lower rates, right? So we don't want to put our members in a position where now they're having to pay more for care because of all this competitive information that's out there. But also, you know, what is the benefit of that level of information for our members, right? That's not how they're receiving care, at least if they have are enrolled in one of our collective health plans, right? And I think that that's why at least we've leaned in with our online tool, because that's the personal information they need to understand what they're going to pay as it relates to the plan that they're in and the product that they're in. So that's the most important thing. The hospital data that's been posted, you know, that's not how they're going to receive their care from a consumer perspective. But on the flip side, you know, it does provide more competitive information for providers, which, you know, I suppose it could go either way as to whether that's a good thing or a bad thing. But we certainly don't want it to incentivize providers to increase their costs.
All right. Well, then moving on to what we're going to see next year. And initially, there were expectations of January 1st, but even if they come in July, we should be seeing a lot of information from carriers, including even drug information about the prices and, again, machine-readable files. There's a fair amount of detail in the rule, but I'm sure there'll still be some questions about how those data are going to be used and what formats we'll actually see it in. So the question is, and I'll direct it starting again with Cigna and Ambetter. What do you see in terms of that playing out? And do you expect to be able to use those files to look at prices that your competitors have with healthcare providers? Do we expect third parties to compile that information, provide the analysis to you? And is that something you would take advantage of? You know, how do we see the future with regard to the files you're going to have to produce and those by your competitors? And, Cigna, do you want to start?
Sure.
Yeah.
So-
The answer is yes to both questions. We'll absolutely be downloading and looking at those files. I'm just going to stress the concerns that I put forth previously with respect to the machine readable files. They are large, unwieldy files. And what's most important to us is to make sure that both our consumers and us are getting meaningful information. I think it's yet to be determined if you really want to know, as to both how we use them and their affect on the marketplace. And I think I put forth concerns regarding competitive issues. So we'll see how this goes.
Yeah, I mean, I'm in the same place. For us, we are working to develop the files, and we'll be looking to produce it in line with the government timeline. Yes, we would also be reviewing those files to the extent that we could in performing our own analysis. I share the same concerns with regard to the format of the files, as well as just the environment that would follow.
Understood. Certainly the department's even considering the availability of these files and what we've done with health cost over the time, which is based on claims data, which are always historical, not going to be as current. The good news is we can take a look at patient encounters, so we can pull that information together. We do produce sort of a downloadable file there as well, which is designed more for carriers and providers. But I guess maybe this is kind of one of the last questions I have. And we've got a couple of comments in the chat box, but if there are other questions from the audience, please send them in now. The last question I would have is just what kind of entity you think is most appropriate to be providing the information? Do you think it should come exclusively from the carrier to their members? Should it be done by a third party like the insurance department or private companies to start to aggregate the data for consumers, for employers, for providers? So Clyde, what are your thoughts on kind of what type of entity is most appropriate to be providing this kind of information to consumers and of course to industry as well?
Certainly. I think all of us, all of the above will be incorporated in the process and will have a part to play in the process. However, I think just with regard to the perception of objectivity and that need for everyone to accept it as an objective process, that government, academic institutions, and potentially independent third-party organizations would probably be in a better position to provide that that view of objectivity.
Thank you. Cigna?
Yep. So all of these organizations can and often do provide price transparency information to consumers in different ways. As a carrier at Cigna, we've offered my Cigna directory and tool for almost 10 years now. And Cigna Express Scripts pharmacy benefit management business offers real-time benefit check to consumers and providers today. But I think they all do offer some form of transparency to consumers.
Any additional thoughts from Harvard or Anthem? No. All right. Well, we are at 11:04, and I just want to make sure I didn't miss any questions. I think we covered there. Like I said, there are a few comments, and we do have the public comment period at the end of the hearing. But if not, I will thank you, and very much appreciate your participation, including the folks from Harvard and Anthem who also have to participate in the small group panel as well. Thank you. And so I think I'll push this one back to the commissioner to give it to DJ and introduce the small group discussion.